So when we're talking about traditional 911, we all have these basic understandings of how it's supposed to work. We expect that we're able to pick up the phone and that we're going to be connected to help. So a business traditionally would have a fixed location. They would subscribe to some sort of telephone service from their local exchange, and through that relationship and through that subscription, they would expect that if in the event of an emergency they dialed 911, that they would be connected faithfully to an emergency answering point that would be relevant to their location. Whether or not it was understood or thought about by the business subscribing to this service, with this traditional way of deploying 911 or deploying telephone service, there would be only a single static location that would be reported to the emergency answering point, regardless of where in that business a person was calling. So we start to take a look at the assumptions that we have as people when we dial 911. We're expecting that when we dial, we'll be connected to help, that the person answering at the emergency answering point will be relevant to our location, so it'll be close enough to us. We'll have the required information to be able to dispatch efficient and effective emergency services to our location. And that finally, and almost most importantly, is that regardless of whether we have the capacity to speak and communicate our need, we expect that the relevant information will be captured by that emergency answering location and be able to still dispatch that help to our location. But we are moving to different types of communication networks. We're deploying networks of IP voice and unified communications. We're leveraging our data networks now to communicate so that we can centralize and consolidate our infrastructure, so that we can take those communications and move them across platforms with fluidity, with ease, so that we can take our communications where business dictates, hoping that we become more efficient, more effective in those communications, so that we improve our business process and, at the end of the day, reduce costs and administrative burden. But when we deploy these new types of networks and we use these new methods of communication, we're also creating a different type of user, also a different type of employee, where we have now mobile communication devices and clients. They can move around. They are now profiles that can be applied to different devices in different locations at different times. They are now device and location independent. And on top of all of these things, when they finally do get dial tone, they might be getting it from communication services that are hosted in an entirely different place than where they're physically located. So each one of these is a new challenge to these traditional understandings of 911. And so how do we respond? Well, we can take a look at how these challenges play out through a high-level analogy. And it's tying into the case study that we'll get to, so it'll be something that can support what we take a look at later on. So imagine a university. Imagine a large university. We might have tens of thousands of students, thousands of academic staff, and on a daily basis moving about an 1,800-acre campus. And so how do we manage this type of deployment, and how does this traditional way of deploying and managing 911 measure when we're facing a deployment or a scenario like the one that we're looking at now? So we have some animations here that I think are looking a little bit static, but what we're trying to show here is if we have callers that are spread around this campus, which is an 1,800-acre campus, and each one of them from these varying locations across the campus is dialing 911, what is the challenge if each one of those callers is served by only a single address? We can see here from this map that there are multiple ways to approach this campus. There are multiple strategic avenues to gain access to different areas. You can see that if you were going to the stadium, you would enter by an entirely different entrance than if we were going to the psychology department. So how do we serve each one of these clients that are dialing 911 if we're only sending out a single address? And if we consider a further example, what if there's a person, let's call him Professor Miller, let's say that he's in his office at the beginning of the day, and he travels across the campus to this location for a meeting with colleagues. Colleagues leave, the meeting wraps up, the person stays behind to take some notes, and immediately thereafter begins feeling chest pain. Pain becomes so much that he passes out, but not before he's able to initiate a 911 call. Well, emergency services in that point would be dispatched to the main entrance. They would go to security most likely and say, where can we find Professor Miller? And they will be pointed in the direction of his office, even though he is located somewhere else. So what we're pointing to here is if we don't have this real-time location information of these new types of users that can be moving around, that can be using different devices at different moments to make calls and dial 911, how long would it take us if we only had that single address to find a person on a campus this large, over a 3-square-mile campus? So what we're pointing to is a need to not only notify on-site personnel to make sure that they're aware of an emergency that's happening, where it's happening, what's happening, who it's affecting, but we want to make sure that when we're delivering calls to an emergency answering point that we're not only providing that single address, but we're providing very specific and relevant information so that dispatch is that much more effective and efficient in their response. But a further challenge that we can take a look at is also when we're trying to leverage these data networks to centralize our call routing. So we might be putting all of our calls through a data center. We can also be leveraging centralized SIP trunking. But how do we make sure that if a 911 call is coming out of one of these branch offices, say in California, but the call is being routed through New York through a data center, how do we make sure that that emergency call gets routed back to the emergency answering point that is most effective in responding to the emergency that's happening in California? So what we're looking for here is a solution where we can centralize that call routing but still get to the relevant answering point. Now, in some cases, a lot of enterprises are saying, well, let's try to approximate what that traditional way of rolling out 911 is by putting in local gateways for each location. What that entails is then subscribing to a PRI or a CAMA trunk with a local exchange that's regional to that location, and so this relationship management proliferates. And for them to break down those additional locations to more relevant and specific locations, they need what's called a PS Alley account, which can keep track of each one of those wings or floors or offices that they would like to be able to send to the emergency response location in that particular city. So we see that though it does solve this problem of getting connectivity that is local and relevant to an emergency answering point, we are making our deployment, our network, and our communication system more expensive. We're complicating its deployment. We're increasing the administrative burden of managing it over time. And as our business changes, as we expand, as we contract, as we move into different areas, we find that to reproduce this in each different location that we find our business expanding into, it's a very difficult to scale solution. So again, we want something that continues to mirror the values of those new types of networks, new types of communication networks of unified communications and IP voice, where we're leveraging those data networks. We want it to be a simple SIP connection to a centralized routing solution that can provide us connectivity to any one of these emergency answering points across the country. So how does it come down to a solution when we're talking about E911, when we're extending beyond traditional 911 to respond to these new challenges, but also these new and exciting ways of communicating? So in putting together the E911 solution, what we're doing is we're breaking down locations from that single address that is no longer effective in responding to emergency calls spread throughout a building with multiple floors, or a need to go down to a more specific location. So we're breaking them down into smaller locations. And how do we do that? We define those locations by network elements. And Lev is going to go through a little bit more of these specifics, but conceptually this is the high level. where we're breaking it down into these smaller locations based on network elements so that these users now that are mobile and moving around can move through these statically defined locations, and in real time we can make sure that their location at the time of originating a 911 call is both reported to critical on-site personnel but is also communicated to the relevant emergency answering point. So in terms of our company, in terms of 911 Enable and what we do, we're a complete E911 solution company. We're specialized in these types of networks, in IP voice and unified communications. Our success is built upon taking on a single focus, a single mandate, and that is E911 technology and innovation. We do this every day, all day, and we're committed to this technology and innovation. So that has helped us serve over 400 customers. We're currently routing over 300,000 emergency calls annually, and we're supporting some of the largest IP voice deployments in the world. So in terms of our relationship with Cisco, the types of networks that we're talking about today, we're supporting some of their largest deployments in the world. We're a preferred solution developer in their CDN network. We've been Cisco partners since 2006. We're a SIP-approved solution. And what this means is that relationship makes it so that we're certifying against the latest Cisco innovations. So what you're deploying in your networks and even the upgrades that you're applying to them, we're making sure that we're certifying with those new innovations and making sure that our solution supports them completely. So Unified Communications Manager versions, the new hosted collaboration solution, etc. One particular point that I'd like to emphasize is that we are the only E911 solution certified with Jabber. So if you have Jabber clients in your network as well, we can support them. One of the things that I think is very important, especially in today's business world when we're deploying networks like this, we no longer necessarily have deployed a single platform across our enterprise. Sometimes we're expanding by acquisition. So we may come up against other voice platforms that we need to manage and that we want a single solution for our 911 needs to support each one of them. And so in view of that requirement, in view of being able to support that for our customers and for our partners like Adcap, we make sure that we have the highest level of certification across each one of these platforms to make sure that we can be a single enterprise-wide solution that can concurrently support each one of these platforms. So just as a customer sampling, we're supporting some of the largest carriers in the world. I apologize for this one being a little bit cut off here. And we've got a short list here of some of our key customers. And the reason why we bring it up is because we want to show the size, complexity, and distribution of some of the networks that we support. But really to bring that perspective back as well, we take that experience and we take that flexibility of our solution and we make sure that it's also applicable, available to our mid-market clients as well. So when we talk about mid-market, we're talking up to 1,000 endpoints. It's a very important business segment for our solutions. We make sure that we put a lot of focus and a lot of support behind our solutions for those markets. Again, we can talk about these values and we can talk about the importance of 911, but also at the end of the day, it might be a conversation that we need to start and that we need to have because there's legislation in the state that you're located. And so it's important to be aware of what these requirements are. It's important to make sure that you're compliant. There's 4 more states that are coming through, and so either speaking to the partner that's helping you deploy or contacting us directly so that we can start to answer those questions for you is probably a first step in defining the solution that you require and how we can support it. So at this point, we can start to talk about our specific solution and the 2 segments that it is comprised, and I will be able to send the controls over to Lev here.
We have a product called the Emergency Gateway, and we have a service called the Emergency Routing Service. Each component serves to address specific customer requirements, so you can actually use one versus the other. You can use them separately, you can use them in combination, and each one solves a particular set of customer needs. So I'll kind of introduce each one in the following slides. So the first component is the emergency routing service. So the emergency routing service, you can imagine it as being a 911 termination service. You send the calls to this cloud-based distribution, and we'll connect the call to the right PSAP or public safety answering point anywhere in U.S. or Canada. So we have direct connections to the PSAPs with direct trunk lines to the selective routers. We also have a data link that allows us to share the location data with the PSAPs. So this is very important. It gives two key benefits. The first is that it allows customers to provide detailed location information based on the state or municipal regulations. So if you need to provide floor level information, room level information, or even wing level information, all that can be pushed out with the 911 call and delivered to the PSAP with this information on a display screen so they can quickly locate the caller. So that's usually the first main requirement. The second one, and because it's a sort of a path that you can deliver all your 911 calls anywhere in North America, it's really ideal for customers that are distributed with multiple sites connected through WAN topology. Essentially, you can route your calls from the main data centers out to our emergency routing service using either SIP trunks over the internet, over a VPN connection, or through MPLS circuit directly in our data centers. We'll take the call, and using location data that's provisioned with the 911 call, we're able to distribute it to the local PSAP. Not only is this great for clients that have multiple sites, but it's also good for clients that have a distributed workforce, people working from home. It's always important to remind people that a lot of the state regulations require every phone that can make and receive calls to and from the PSTN network needs to have 911 service activated. So you can't have a teleworker without a 911 service for most of those locations. The ERS makes this possible. It makes it possible to have a person connect to their local PSAP wherever they are based on the address provision for that device. And the emergency routing service also has notification features when used as a standalone solution. So that's really the key components of the emergency routing service. The second component is the emergency gateway, and that is the component that integrates or works with the call manager or any other certified PBX system. The main goal here is to feed or collect the location of every single device on the network. So in the past, what people have been doing is static phones, say a TDM phone or analog line, whenever someone would move the device, there would be a service order request, and it would go through a workflow which allows administrators to capture the location of the phone. With IP phones, you can move them as you want. You can have share line appearance, extension, mobility that keep moving the extension around or the user around from site to site. So ultimately, the only solution to ensure that the location is valid is to have an automated tracking solution. So the emergency gateway, the way it works is instead of trying to have administrators tie location to each and every phone, it allows administrators to tie a location to a network element. So that can be a subnet, it can be a switch and port, it could even be a wireless access point. Those basically don't change very often, and if they do, at least they're under the IT infrastructure team's control. So they're always logged and monitored, and it can be documented. So your users can move freely around, and the emergency gateway simply figures out if the phone belongs to a specific subnet or is connected to a specific switch or port, or if it's a soft client connected wirelessly to an access point, is able to assign a location based on the data that's been provided for the network maps. So phones can be tracked down to the device level, and that information can be fed to the emergency routing service during a 911 call, so that at the end of the day, the team or the PSAP gets the detailed location information. But we also put a strong emphasis on security notification as well. So an effective response to 911 is essential. It's essential to have a security notification for that to happen. So your security team needs to be made aware that a call is being made, who's making the call, from what location, what's the callback number, ideally what is the name of the person, and any other pertinent data that can be used to speed up the response. At the very least, the security team has to be there to give access to the first responders when they come on site. And at best, the security procedures can be followed based on that information to respond internally and speed up that response process. So we have screen pops, we have email notifications, we have features that allow calls to be monitored by security teams so they can listen into the conversation. There's alarms and reporting that's available for follow-up. So all that has been built and designed to meet pretty much any requirement the customer may have. We have some specific requirements that are for specific verticals, and others are more generic that are used by all the clients. So those emergency gateway appliances always come as redundant appliances, so they're always active. Everyone needs a highly available solution for E911. They're either available as physical appliances, so they're 1U appliances that you deploy in your data centers, or they can be deployed as ready-made OVF images, and they can run on a VMware environment on ESX servers. So these are certified with VMware to meet their specific criteria. They'll support vMotion and high availability. And ultimately, these emergency gateways are designed to be enterprise-wide deployments, so they can support the entire workforce. A single pair should be able to support any size of customer, support multiple locations, multiple clusters, and call manager versions, including other PBXs. Now, some of you may be familiar with the emergency responder product from Cisco. And that is a solution that can be used as well, and it can be used in conjunction with the emergency routing service. It's a fairly basic 911 solution. There's some specific items that you should know about should you have these issues in your environment that the emergency responder cannot support. For example, as soon as a customer needs to do phone tracking down at the switch level, but those switches are not catalyst switches, then the emergency responder will not support the discovery for those devices. It won't support multiple platforms, so it has to be all Cisco deployment. If there's any Link or Avaya or any other phone system in the picture, then the emergency responder will only service the Cisco devices. For larger clients, and probably one of the big reasons why we have so many large deployments as well, is that as soon as you get into multiple call manager clusters, then you need to have multiple emergency responders managed, to support them. So deploying multiple emergency responders, managing them independently is an expense and an additional complexity to the solution. So with our emergency gateway, we can support multiple clusters at the same time. We also have support for wireless phone tracking, which is particularly useful for soft clients, people running on laptops, going to common areas. They'll connect to a local access point, and we'll be able to discover the location down to the access point. We support overlay tracking mechanisms, which allows customers to have the capability of assigning locations to switches and ports and wireless access points all at the same time, and select which one is more accurate. So if we discover using one method and a second method, we can select which one is best. So the practical case would be you plug in a phone in a building, we figure out what summit it's on, so it would be in a specific building, and then after we discover from the switch what port you're on, so we would know what floor or room that device is physically located. So we would have a location in its entirety, where a CER would probably have a situation where for 2 or 3 hours there would be no location tied to that device. Also, you have to look at the endpoints that the customer needs to have. So if you're using Jabber, CookieMock, CookieLink, there might be some limitations with the emergency responder. Our philosophy is that any device that is a Cisco certified device that's developed by Cisco has to be supported in equally just as well as a hard phone, so that you don't have any limitations in terms of devices that you're using. And in terms of notification, we have a little bit more robust capabilities in terms of how the screen pops work, the kind of data you can provide. We can bridge in security as well, and we have ways of having users barge into a call or security to barge into a 911 call when required, for example, in cases when the user is incapacitated. So ultimately, the idea is that emergency responder can be suitable for certain customers, and there's definitely use cases where it's the ideal solution. But there's also specific cases where the emergency gateway could be or should be used in those environments. And ultimately, at the end of the day, when you're using ERS and the emergency gateway, we've optimized the two to work together so that it's seamless, it's less error prone, it simplifies the workflows between the different groups in the provisioning process. So that is really one of the keys that we focused on, and because of our energy and our focus, we've been able to provide a solution that really is easier to manage and simpler to configure.
All right, hello folks. This is Michael Cavanaugh with Adcap Network Systems. Want to talk a little bit about, now that we've heard about 911 Enable and some of the parts that make up the solution, want to translate that into how does that work in the real world and where are good fits for this. One case study I want to talk about is in higher education, a fairly large higher education campus with 2,500 endpoints. So we approached this higher education customer, talked to them about a unified communications design, put together piece parts from a call manager perspective, Unity, various applications in the UC world, contact center, things along those lines. When 911 came up, we had a couple of challenges. Looking across their infrastructure, they were not a Cisco infrastructure as far as the LAN WAN piece. I had a lot of HP switches out there. And as Lev pointed out on the non-Cisco switches, that can be a challenge with emergency responder. So reaching out to 911 Enable and talking about what options can we do. So we started down the path of what was just presented and came up with a design to meet the needs of the university. So on these challenges, right, so we were centralized SIP trunk. Right, so on my SIP provider, had some challenges with them providing a reliable 911 service down to the level that the university wanted. They were HP managed switches. They did have Jabber clients out there. So tracking all that was a bit of a challenge. We had to have 911 everywhere, had to do very granular, detailed reporting statistics on both the wired and the wireless side. So based on that, again, back to 911 Enable, talking about some of the solutions that they can do. So pulling them in, we could do a centralized 911 dialing plan that did allow me to go down to the wireless access point, to the switch port, and report back to the PSAP exactly where that caller is. So Jared earlier had talked about a professor that went from one location to another. We can do that with the solution. In this customer's case, that's exactly what they were looking for. In their world, whether it's a Jabber client on my PC or if I physically pick up my phone and I move it to another building, since I am IP, how do I track that? So that's the solution that we were able to offer for them. So working with 911 Enable, with their design team, with their support team and installation team, we were able to add on to the existing UC environment exactly what the customer was looking for. So at the end of the day, we end up with real-time 911 location routing to all PSAPs in the United States, right, and in Canada. So we can proactively track all my devices, since, again, we're an IP world, and identify exactly where they are. So I do have, across the campus, across the enterprise network, the ability to deliver emergency services where they're needed. Does that make sense to everybody?
Kat, it doesn't look like we have any questions, so. Yep. Moving forward, if you guys have any additional information, you can reach out to me, Ashley Griffith, at Adcap Network Systems. Here's my contact information. And if you have any additional questions, we have contact information here for 911 Enable, Jared Miller, who is our first presenter. But we do have a couple of questions. So, Jared, do you support shared line appearance and or hunt group or pilot numbers?
Well, I think for the Q&A, I will step back and allow Lev to field the questions if that's okay.
Okay.
Sure, I can do that. So Shareline and Parenting Extension Mobility, we support both. So all of our phone tracking is at a device level. So really what happens is that a location is tied to a physical device or a soft phone instance, and the actual user information comes to us at call time, and we simply use that for notification purposes, or if it's a DID, we'll provide callback number information to the PSAP.
Okay. Lev, we just got another question. Are there any delays on the 911 call by going through the ERS service versus going directly to the PSAP?
No, there are no delays. I mean, this call connection time is milliseconds. So whether you go through a regular PRI or through the emergency routing service, the delays are unnoticeable to the end user.
Okay. We have a couple more questions that are coming through. How do you track phones to the wireless access points?
Sure. So the method of phone tracking for wireless essentially comes to the fact that if it's a hard phone versus a soft phone. For soft phones like Jabber or IP Communicator, we provide a service that installs on the PC. It's called the E911 Soft Phone Locator. And essentially, it runs silently in the background. There's no user interface. It's deployed using Active Directory as an MSI file. And all it does really is it monitors when the PC connects to an access point. And when it does, it sends out an event to the emergency gateway to say this soft phone instance is assigned or connected to an access point with this BSS ID. So a BSS ID is a MAC address of the air interface of the access point. And so we would have the association between the device and the BSS ID. From the administration point of view, we would expect administrators that want this feature to assign the BSS IDs to locations. So when you're providing the network maps, you would have your BSS ID range for the access point and the physical location it's serving. So basically, if we have that information, we're able to link the device to the actual location.
Okay, and the last question that came through was, with CER, you still have to get trunks and PSALI service for connectivity to emergency answering points. Does your solution take care of both segments?
Yes, so basically the emergency routing service can eliminate the need to go to a PRI trunk and use PSALI. This is especially important when customers move to a SIP trunking solution. Very often the 911 component is not available. So the ERS basically is used to funnel all the 911 calls. So from your call manager perspective, you're essentially branching off the 911 calls to the emergency routing service. And for your inbound, outbound calls, you're using whoever you want as a provider. It can be a PSTN provider or a SIP trunking provider. And the ERS can interface both with the EGW and with the emergency responder. So you can actually use the emergency responder to connect to the ERS. The emergency responder still maps the calls to an ELIN numbers or phone numbers, and those ELINs can be provisioned in our emergency routing service. So they can still be serviced to some extent. It's just not, you're still mapping ELINs, and you do have some issues when it comes to the teleworkers. But there's capabilities or possibilities to connect the two together.
Okay, wonderful. Guys, that wraps up our presentation. Again, I just want to thank everyone for joining our webinar today, and we look forward to speaking with you soon. We did record this, so we will be sending out this recording to everyone who has registered in case you need this for future reference. But I hope everyone has a good rest of the day. Thanks again.